We are going to watch that together. America is going to watch those trucks with those vaccines going out. I got Peter Hotez with me. I've got Roland Martin with me. Roland, it was important for me to have you here today because I'm in your hometown. You're not in Texas, but we are in Texas where you come from. And one thing I want you to talk about, you're an expert on a lot of things. The one thing you and I are not are vaccine experts. But what you know about your home state of Texas, which is the size of a country, both physically and in terms of population, is that there are healthcare deserts in this state. There are pharmacy deserts. There are counties where there is one doctor. There are entire counties where, okay, here we go. We got a truck moving. Hold that thought, Roland and Peter Hotez and Ellison Barber. We are now watching the UPS truck move about 4 inches, actually. Maybe they were checking it to make sure that it was actually good to go, because once that thing goes, they know that there are going to be U.S. Marshals there. There are going to be cameras on it. There's a second UPS truck now pulling a few inches ahead. I guess they're trying to coordinate this. Remember, there is a big there's a security concern here as well. There are U.S. Marshals there. They need to make sure that nothing stops these vaccines from getting to Lansing Airport or other destinations that they're going to, and that nothing stops them from being loaded onto those planes. And you know, at Lansing Airport, UPS and FedEx are checking their planes and checking them twice to make sure nothing is out of order. Normally, moments before a plane takes off, a pilot makes a pre-flight inspection of a plane. They are going to be doing that already. They are going to be ready to roll, because this thing has to get to Louisville and get to Memphis. Those two planes, there may be more planes going. They got to get to those two hubs, and then you got to see how these operations work. It is clockwork. They will move from those planes back onto more trucks to go to other hubs, or other planes to get to other places. And by tonight, cities like Houston, like Miami, and other places across the United States will be getting boxes of vaccines arriving. They will go to their hubs in those cities. It is unclear whether they will take delivery tonight, but I guarantee that every hospital, every military facility, everybody who is planning to get vaccines is on high alert and will do so when they get it. Roland, we're going to watch this, and when those trucks move, I'm going to interrupt you again, but I want you to tell me about your state and the fact that not everybody's in Houston. If you need your vaccine and you're in Houston, you may get your vaccine this week. But there are people in this state without health care coverage, and without hospitals, and without doctors, and without pharmacies near them.
For all the greatness of the Texas Medical Center, when you talk about the hospital district that's in Dallas and the major cities, folks really don't understand how dire the situation is across the state, but also across the country. I'm actually live in Atlanta, Georgia. Yesterday, I was in rural Georgia. And what you have seen in this country, so many different states, red states, refusing to have Medicaid expansion. You've had rural hospitals shutting down all across the country. You know, in the aftermath of the Affordable Care Act, I mean, you see how significant this is. When you talk about individuals who have filed for bankruptcy, what do they largely file for? Health care. And so we have to confront this idea of health care as a fundamental right in this country. That's why you see the whole battle for Medicare for all as well. When people say, we have this great health system, it's great if you have money. It's great if you have a great health care plan. But imagine the wealth inequality in this country and the lack of resources, and how we have grossly underfunded our public health infrastructure. And I'm sure the doctor would agree, Dr. at Texas Children's Hospital, one of the greatest children's hospitals in the country. But there are many kids who simply can't afford to be able to be treated at Texas Children's Hospital and others. And that is a fundamental problem that political leaders, whether they're in Washington, whether they are in Austin, whether they're in the county government there in Harris County, or in the City Hall, have to contend with.
And Dr. Hotez, this is a fact that we're trying to fix, but it's not being fixed. In the Rio Grande Valley, I'm going to be talking to Dr. Ivan Melendez, who's the chief health authority there. They've got rates of death and infection that are substantially higher than the Texas average and the state average. And that story is repeated across Texas, and it's repeated across America. That hasn't been solved. In the months in which we have been able to watch this logistical amazing feat heat that we have never seen other than in a wartime. What you are going to see in the next 72 hours is something that has never been done outside of wartime in terms of the logistics of getting these vaccines out. Imagine if we had that sort of effort to actually deal with people's basic primary health and make sure that everybody in this country gets the same chance of that vaccine as people in cities or people with health insurance or people who are wealthy or people who live near pharmacies and doctors.
Yeah, I think, Roland is absolutely right about the quality of care, especially for people who live in poverty. Although I will just make one point about Texas Children's Hospital, where I work, that it provides probably more care for kids living in poverty than just about any other healthcare institution in the United States. So, our CEO, Mark Wallace, has this extraordinary commitment to helping kids all around Texas and even globally. But the point is otherwise well taken, that we've got an incredible level of poverty here in Texas. We have great wealth and we have great poverty, probably the greatest disparity between wealth and poverty of any state in the country, as measured by what's called the Gini coefficient, which is an economic indicator. We have 5 million Texans who live in extreme poverty, and that's a real issue. And ensuring access for cutting-edge measures is going to be really important. And we also have this problem for the COVID-19 vaccines. A lot of vaccine hesitancy and concern among the African-American community because of historic racism, structural racism, and the fact that there's so few African-American physicians and healthcare providers in this country, especially African-American male healthcare providers for physicians. We have to fix that. We also have to fix a pretty aggressive anti-vaccine movement that specifically targets African-American populations, and that's really tragic, and we're not doing anything about that. So having the vaccines are wonderful, but getting people vaccinated, there's going to be a lot of hurdles and a lot of bumps in the road. We're going to see, that this Pfizer vaccine is probably the most logistically complex of all of the vaccines in terms of onerous deep freezer requirements and how we manage that. Other vaccines will follow. We'll have the Moderna vaccine, I hope, next week, which is also an mRNA vaccine, also requires freezing temperatures, but not as complicated. And then we'll have a couple of adenovirus-based vaccines from AstraZeneca, Oxford, and J&J, a particle vaccine from Novavax. We're hoping our vaccine. And so we'll be looking at half a dozen vaccines before this is out.
Hey, Ali.
And there we have the UPS truck moving out. Hang on a second, Roland. We got that truck moving out. We got Ellison's camera on the right. We've got the pool camera on the left. We just saw an armed guard walk by, checking things out. We got a photographer there in the green vest. That is probably a Pfizer employee or somebody there who's taking pictures, making sure that this moment in history is caught. The UPS truck about to just drive by that FedEx truck. The FedEx truck looks like it's been cleared to go. So I think what they're doing is they're positioning there. They've moved out of the dock. The loading is finished. The trucks are finished. There are officials with radios walking around those trucks, so I think they're doing whatever final check, making final arrangements for how they are going to ride, whether it's in convoy or what they do if anything goes wrong. So we've now seen both of those trucks, the two first trucks that will depart, ready to go. They're not going yet. Roland, you were saying?
Yeah, the point the doctor was just making there, and I need people to understand how this thing really begins to expand and how it trickles down. When you talk about the inequality when it comes to health, he laid out those health disparities. When you see the numbers, when in terms how black women, maternal health, how you have racism within in the medical industry where black patients don't get the same care when it comes from white doctors as well. Then you see the inequality when it comes to resources. Look, I'm looking at the billions that are going to be spent on communicating these vaccines to various communities. The question then becomes, how much money and resources does black media, folks like myself, actually get when it comes to sharing those messaging, when it comes to where those resources are being spent? The federal government spends $5 billion over a 5-year period on media. Black media got 51 million of the $5 billion. Also, inequality. And so when you confront where we are as a nation, how black and brown communities have been starved have been, frankly, starved of resources, starved of opportunity, then you begin to see how it plays out in the health disparity, why African Americans are so greatly impacted by coronavirus, dying at a higher rate than anyone else as well. And so it calls into question in this nation, how do we expend resources? There is a national health care plan. They're called emergency rooms. That is not a good idea. I was a county government reporter in Austin. You're paying higher taxes to cover the health care expenses from ERs. Imagine if we provided the health care for Americans, then you wouldn't see the money being spent there. But it requires the will of those with resources in this country to be willing to say, I have to think more about myself than anyone else. And coronavirus and illness has a direct impact on our economy as well. Sick days, folks not being able to get there, public transportation. And so we as a nation, for all of our greatness and riches, must confront the gross inequality in this country. And a lot of it has to do with race in America.
Let's talk a bit about that messaging, Roland, that Peter Hotez was talking about, particularly amongst some African Americans who are concerned about being at the front of the line to take a vaccine. There is a rich and scarred history in this country about experimental drugs being used on African Americans. Obviously, the first run of a vaccine is scary to a lot of people. We have about a 63% acceptance rate, which we'll probably start to see increase over the next days as we start to see people being vaccinated. But have you heard about that amongst members of the African American community, an increased level of concern?
I've been black 52 years, and I've heard it for 52 years. Of course I've heard it. But this is also where trust comes in. And it's no disrespect to all of the well-meaning and frankly, good doctors who are not black. But the bottom line is this here. The stats don't lie. African Americans get better treatment and have greater trust when they are getting care from black healthcare professionals, when they are receiving information from trusted black sources, when you have African Americans. Look, one of the things that I've done on my show, Unfiltered, for the past 6 months, I have purposely, more than anybody in mainstream media, put on black scientists.
Roland, let me just stop you. Let me just stop you for a second. Take a look at this, Roland. They are now leaving the premises. This is Portage, Michigan. I think I said Maine earlier. It's Portage, Michigan. Under escort of United States Marshals, the United Postal Service, the United Parcel Service, UPS. I'm an old guy. I still know it by its old name. UPS truck is moving off the premises now.